So what is ultraviolet light, or most commonly known as UV light? So these are electromagnetic radiation, high frequency waves which can damage the living tissue. So these are also part of the invisible waves, as in we cannot see the UV rays. And July being the UV Safety Awareness Month, I am Dr. Samhitha, Consultant Pediatric Ophthalmology and Strabismus at Nethradhama Super Speciality Eye Hospital, Bangalore. We need to protect our children from these UV rays because children have developing eyes and they have really sensitive skin and eyes which are more prone to deeper and quicker damage from the UV rays. So if you cannot see the UV rays, then what is all the fuss about? Where does it come from? How does it damage? Let's learn all about it. So the main source of UV rays is the sunlight. So 10 AM to 4 PM is when the harshest sunlight is going to be there and more amount of UV radiation is going to be there. Other man-made sources of UV radiation are mercury vapor lamps or the lamps which are used during tanning, or even the blue or black lights. Does laptop emit UV rays? So do I need UV protection for my child when they are viewing the laptop? So that is a myth. Laptops do not emit UV rays. They only have blue light and not UV rays. Similarly, our microwave oven. Oven does have a very small fraction of UV rays, but mostly it has non-ionizing radiation. So even it's very safe to use your oven, do not worry about it. So UV rays can affect almost any organ or any part of the eye, including the eyelids, the conjunctiva, the cornea, which is the black part in the eye, the lens, and also the retina from which we see the world. And there are some kind of cancers which can come due to these UV rays. Especially we know about the skin cancers, and these can affect the eyelid skin as well. So the most severe of these are the squamous cell carcinoma or the SCC, which affects the superficial layers of the skin, the basal cell carcinoma, which affects the deeper layers of the skin, and the melanoma, which affects the pigment bearing cells in the skin. It can also cause a condition called as macular degeneration, where the macula or the part of the retina where we see undergoes a degenerative process due to this oxidative damage, and this sadly has no cure. So that is how it is so important that we have to avoid UV radiation and we have to protect our eyes. So for children, and especially Indian children, we have type 3 or type 4 skin. So the maximum sun exposure which you can give for your child is 30 to 50 minutes. That is a half an hour to around an hour, because beyond that it can cause UV damage to the skin as well as the eyes. So first and foremost, always ask the child to wear sunglasses, especially in hot sun, and the sunglasses should have a wide frame and cover the eyes, especially from the side, so that it gives an overall coverage to the eye. And also wear wide brimmed hats which can cause shades on your eyes and will protect the eyes as well. Definitely it is very safe for your child to wear sunscreen. Only thing is, look out for sunscreen lotions which do not have added preservatives, and that I think the dermatologist can advise you, but it is definitely safe. Go ahead and give sunscreen to your child. So follow these precautions and save your children's eyes from UV radiation and avoid all the unnecessary evil complications which are associated with UV rays. So let's have a UV safety month and protect our children's eyes. Thank you.